If you want to launch big ships, you have to go where the water is deep.
Our featured speaker today is the founder and chief clinician at Halcyon Clinical Services LLC, a mental health practice that focuses on providing treatment for working professionals of color. A behavior scientist with a Master of Social Work and a PhD in behavioral science, Dr. Wright is a seasoned public speaker, practitioner, and professor. Dr. Wright, it is such a pleasure to have you as our featured guest today. Thank you so much for taking the time to share your journey with us.
Fantastic, Nancy. Thank you for having me.
Well, we really do appreciate it. The honor is ours. And I was wondering if you might, kind of start us off, taking us back in your journey and talk about some of your experience growing up. Do you feel, like there were some early events in your life or maybe some influential people that really have shaped who you've become, both personally and professionally?
Oh, that is a, I can be long-winded at times, but I'll give you the abbreviated version. Yes. So I grew up in a small uh, town called Cornwall District in St. Elizabeth, and most folks may be familiar with Jamaica. And at about 12 years old, I migrated to Connecticut, which is entirely different than my small district in St. Elizabeth, Jamaica. What most folks don't realize is the two most influential people in my life was my grandparents, Lillian Wright and Osborne Wright. My dad, hence the name Orlando. My dad lived in Cuba. My mom doesn't give him credit for the name Orlando, but he lived in Cuba and my mom lived a town over. But I was raised by them from birth to 12 years old. And that was probably the most grounded, secure experience. My granddad had lived and worked in Europe for a number of years. And so, if folks are familiar with the Jamaican experience, people tend to travel to a number of very select places. It's either going to be England, Canada, Toronto to be exact, and or three places in the United States. Uh, the third most folks don't even consider, but it's often New York, Florida, and Connecticut. It's a huge population of Jamaicans there. But my story began in Cornwall District, St. Elizabeth, which overlooks the famous Bamboo Avenue or Holland bamboo, as we call it in Jamaica. And it's where the bamboos cover the tree. And then also the Appleton Estates. I'm not going to get too much of my family history, but I love to talk about the genealogy and the stuff that we do. But those two folks, my grandparents, were very instrumental in my life and upbringing and were heavily engaged in education and did their best to make sure that that was something that was pushed. And for those who are going to now become familiar, Monroe College in Jamaica is a high school that you have to pass what was called the common entrance at the time. And I left to live with my mother for the first time as I'm, turning into a teenager. So when I moved to Connecticut, it's when I met probably around, I want to say around 16, 17 years old. I had an interaction that was life changing. I met a lady named Lisa Mastronardi, who happens to be of Italian descent. Short lady goes, "This is your lucky day." And I started working with a program called the West Middle School Committee at the time. The fact is that I met some of the most influential people in my life through that after school program that originally started me having to do community services because I had to. And I'll leave that part out, but I think what's most important here is I had to do this work. She hired me. And the president of that organization was this lady by the name of Dr. Luis Loomis. Lisa also had a program called Career Beginnings. I'd always been a pretty bright student in terms of the work and engaging in that way. And so we connected. and there was a program called Beginnings that I had not gotten into. And it goes again to the power of connections, right? And she took me one day and her she took me one day and said, "Hey, you got to go meet this lady." I told her I'd attempted to get into the program. She goes, "We got to go meet her." And she's like, "Yeah, you got to put him in the program." And so that's what got me ready for college. I did. Dr. Louise Loomis was the person that taught me algebra, and I would go to her house. At the time, she lived in West Hartford, Connecticut. And I would go to her house and we would have these tutoring sessions for algebra. And she wrote my recommendation to the University of Connecticut. And so while I was in that program, I met a mentor who's still connected to me all these years later. I was about 17 years old. Was a guy by the name of Tracy May, who was instrumental in just, he was about 5 years older than me. And he was in the insurance industry and we connected and he assisted along that path. So that program alone had about 3 or 4 individuals there that became really strong allies. That pathway then sent me off to University of Connecticut, where I first started. And initially, I knew I wanted to be in healthcare, but I was still figuring it out. That's how I landed at the University of Connecticut, and that's how I landed from Jamaica into Connecticut. And with my grandparents no longer around, I sort of had to figure out how I had to maintain that education piece. So I did my undergraduate and grad at University of Connecticut.
Thank you very much for sharing that. So you said that you always knew you wanted to get into healthcare. How, where did that desire come from, and how did you know that like behavioral sciences was sort of the way you wanted to?
I figured out behavioral science later, but the healthcare portion of it came because, so for the first time, my maternal grandmother worked as a nurse's assistant. And I would bring her lunch and food because she would go to work. And then my mom became, this is sort of like the Jamaican story, right? Is that folks come, they start out as CNAs and then they become LPN and then eventually some folks become nurses. And then the second generations of folks who are migrating, typically they want them to do different types of roles. So I think that that's what happened to me is seeing them in healthcare, interacting. And at first, believe it or not, my undergrad, I had a minor in gerontology for that reason. As I was figuring it out, that's really, I think, what drove the process. And it was fascinating. I had no idea which direction I would particularly go in. And I started out as a nursing major. I had a teacher who I think it was biology or no, it was physiology class. This thing, the serendipity that happened in my life is amazing. And this teacher took a liking to me. She set me up with what at the time was the University of Connecticut Health Center at a mini medical school. This is a diversion from the story, but when I was young in Jamaica, we were peanut farmers, and I put a peanut in my ear and had a small hole in my eardrum. And by the time I came to the States, I went into this facility when I was about 13. And the guy goes, "I can fix that for you." And I go, "How are you going to do that?" And he had a small opening in the back of my ear and covered up my eardrum. And I was fascinated by it. I was hooked.
I've had one as well.
You've had, see, look at that. So, yes, whatever the name was, I was fascinated by that. And so that's one. And then two, that fascination continued where I'm just sort of figuring out sort of what space in the healthcare would be for me. And somehow I may have expressed it along the way. And this teacher in physiology class recommended me to go to the Yukon Mini Medical School. I still have a picture of my heart because I volunteered to have them do a sonogram, I believe. I think I said
That's
that
very cool.
correctly. A sonogram of my heart when I was about 17 years old. And that also piqued my interest. And we participated in several weeks in this type of program. Nonetheless, those were some of the core things that happened early on, right? That started moving me in this particular direction. As I went into college, I started thinking about what would be the best fit for me. Like what would be the most impactful avenue? And I knew I was good with people. I'm talking about like I can really engage folks and have great conversations. I've always sort of been like that. And so I started thinking about social and behavioral science as an extension of healthcare. Met a couple folks at the University of Connecticut where I had to do training for, as folks may or may not know, I mean, go Yukon, right? But at the time I'm coming into the school, the girls and boys basketball team is bringing a lot of attention to Yukon. So, as you imagine, it's on the national stage in the United States, but it's also having this rich discussion around sexual assault on campus or challenges that might be happening because of folks who may be playing sports or because they wanted to make sure that there weren't going to be people unsafe on campus. And I became one of the trainers and the founders of a program called Men Against Violence Against Women through the Women's Center. And that once I found that bug, I was doing training for every freshman coming into the school that year. Did really well at it. Joanne, who was the trainer at the time through the Women's Center, I think I found my niche at that point. And so I started one, I was good at presenting, I was good at engaging with people. And so that I think led me to the place of thinking about systems, macro systems, and how that would actually be impactful with people's lives.
Thank you for sharing that. I can see the logical link now. At first, I thought you were going to say that you were leaning towards physical therapy first, but I totally can understand, the need with so many more people on campus too for that training. I'm kind of like following the lead here and wondering, how you got into your career and then started your own practice and kind of adding on to that, when you did start your own practice, what did you feel most and least prepared for?
Oh, that's a good question, Nancy. Most prepared. So the Jamaican moniker is that we never do one thing. So I'd never, while I was doing all of that stuff with school, I was also involved in the entertainment industry. So on weekends, I make these connections between things that I think sometimes is interesting. But on weekends, I would throw parties at the school and I would hang around a bunch of DJs, right? And so I love music. At the University of Connecticut, we formed an organization along with some friends, enterprising young men. We formed this organization, and and it was supposed to be a political, social, civic type of entity, and it ended up being an organization where it was much more social. In other words, we were throwing events in the cafeteria and doing all types of things. So we got an opportunity to nurture some friendships at the base of it, and then most importantly, out of that experience, Nancy, I met a guy named Michael Powell. There were a three-person, they were DJs. He took a liking to me and they would do nightclubs. I became the person who would do a lot of street promotion. So I'm getting my marketing chops in play. I never took up DJing, but always loved music. Mike and I would travel and I would see and soak up. Well, subsequently, Mike became uh, a person who would do, now he owns, probably it's called Sound Guys, but he owns software engineering sound system that actually sets up for, pretty large size events. And they do not just in the States, but they do Caribbean as well. But early on, I started to tinker with business. This is a jump, Nancy. It's going to feel so the preparation happened early on, right? With being around these guys and learning the business of marketing and entertainment and seeing how that bridges the gap between whether or not we can make money doing what we did. So we always wanted to take a skill that we learned and develop a business around it. So this is the leap. I'm going to tell you, it's coming full circle eventually. But the leap was in about the year 2001, I started my company and I wanted to be in the insurance business. And the reason why I wanted to be in insurance business, remember that guy, Tracy May, that I told you that I met? He was in the insurance business. So I got my Series 6 and 63 in the States and my life and health, all while I'm working a full time job. And then I started this business and I connected with a bunch of folks in a company and selling life insurance and financial services. So I learned one, the fundamental of marketing and entertainment. I'm now venturing on my own and I'm a part of these groups that I'm learning about the financial services industry. And I'm talking about, I'm in Anaheim, California at 20 something years old. I'm in Las Vegas for conferences, some of the best experiences ever. While at the same time, I'm learning this, we failed miserably, right? The financial services business failed because our partner, she was from Vietnam, and things just changed in terms of her family. But nonetheless, I continued to kind of tinker with it and had learned sort of the fundamentals of investing and financial management. Subsequently, started to partner with another guy, and we did a once a month event that was hugely successful in the state of Connecticut. And because that event was really successful, I ventured off and started tinkering with websites and developing the entertainment process while at the same time working. And so that prepared me for my practice. And the premise around Halcyon Clinical is also another full service moment, is because Halcyon, while I was in high school, I took an AP course, and a teacher would introduce us to new words. Her name was Miss James. And we always thought that if you don't pass Miss James's class, you would not be able to go on and do college, or you won't be able to graduate. She was a tough cookie. And Miss James introduced me to the word halcyon. As a result of that introduction, I don't know why I love that word, but I would write poetry at the time. And I wrote a poem called Halcyon Days. And so here goes the full, the full circle, is that while I'm doing all of this stuff in college and I had taken this word from my teacher back in high school, I then went through several iterations of failures around thinking about business while I'm simultaneously having my career and finishing my bachelor's and master's. But what I started to develop was that I'm a generalist in a really, I mean, for a unique, from that unique perspective, right? I started converging all of what I had learned. The word that stuck out to me was halcyon because it fits with what we're trying to do in terms of the behavioral health field. Because it's really about the story around the Greek mythology of the bird that helped to calm the seas for a period of time. And it just stuck out. And so the early pieces of business got me ready to set up my marketing. I knew where to go get my logo and stuff done. I knew how to do the website because I was doing it for the entertainment stuff already. So I did, that website is done by me and me tinkering with stuff.
Well done.
And then because of the insurance world, I knew how to navigate to which insurance company to be paid for the services that we provided. In terms of downside, I had never scaled a business outside of working for others, right? So you may work in an existing environment where you're manager's middle manager. But after about 6 months, I paid off a car note, and I go, I'm going to take the car note. I'm going to pay for my rent for this facility. And being as ambitious as I am, I started to scale the business in about 6 months after I started. So within the first year, and I scaled to one person. And Nancy, did I learn my lesson? I also decided I was going to open another location and start to scale and go big. And then COVID hits. And then the public health system changed, and they said, look, you can't see anybody in person. I was not a fan, as much as I love technology, I was not a fan of doing treatment or therapy online. And I had to pivot really quickly or just failed miserably. So I had to call the folks up that I had signed the lease with recently and say, and because it was happening in the time, I was able to pull back. And I said, all right, the second location, unfortunately, I'm not going to be able to continue doing it. You see what's happening. Everything's changing. So, Nancy, when you ask about what some of the challenges were of that, it was one of the biggest challenges, is that scaling quickly in a grand type of way wasn't the direction for me to go. However, I started to think about scaling deeply. And that was because I had to lick my chops from that experience, lost the money that I put up for for office furniture and everything else.
Well, that's the definition of failing forward, right? You took that experience and said, "What can I learn from this?" It's amazing.
Absolutely, absolutely. So through that experience, that's one, all of those other pieces had set me up to do that portion of it well. And then as you think about scaling beyond yourself, failed miserably at it.
Wow, I think it's really cool to hear about how you've combined these different experiences and different learning journeys that you've been on into this one venture that you're working on. I think it's such a powerful skill to be able to take knowledge from one area and pull it into a new one. So I think that's awesome, and I really appreciate you taking us through that.
Hi there. If you're enjoying this podcast, would you mind leaving us a review, a like, and subscribe on your favorite podcast platform? Thanks so much. That really helps our reach. The Founders Voyage podcast is now proudly sponsored by VidOps. Kane at VidOps has been taking care of our editing since early 2024. He works efficiently, and I'm sure you'll agree that he does a great job. Thank you to VidOps for helping bring this podcast to life. If you want the same great support we're getting for your podcast, or you need help with video, photography, or animation, you can get 10% off at vidops.io using our referral code Voyage. That's vidops.io, referral code Voyage. Now back to the show.
Giovanni, you had a question you wanted to ask?
Yes, I have a quick question. I follow your incredible story, and it was very, very touching and interesting. And I was wondering what was the most defining moment that shaped your career and the way you approach to your work. Thanks a lot.
That's a fantastic question, Giovanni. A defining moment. There are three defining moments that I could point to. I'm going to give you one. There's one that I always keep for myself. There's one that occurred in Jamaica, and I'll give you the one that I can publicly share. It was moving out of the state of Connecticut to the Washington, D.C. area. I took a huge leap. I moved my wife and my two daughters. It's enough where it's different, and you're closer to the nation's capital, and it is enough to be as disruptive. The children were much younger. I mean, we've been here about 8 years, going on 9 at this point. But it was enough of a calculated risk, and it paid off significantly. And I'll tell you why. When I first came to this area and I was interviewing for jobs, I formed Halcyon while I was in Connecticut. There's something about the Washington, D.C. area that propelled the movement of what I wanted to do and refined it. So that's one. And then two, I started to really refine this process of being one, a entrepreneur. Remember, I have been working these part-time jobs all along, right? I've never worked for one organization. Just signed, and that's the Jamaican model, right? So I took that and I formulated how I could work for myself part-time. And so as we positioned, I'm giving you the synopsis of it, but it developed over time. So that's a powerful thing that I thought happened as a result of moving here. One, it's an expensive area. Can't rely on one income, or it's just not beneficial. But it's good to have other ways to think about what it is that I would be doing while being in the Washington, D.C. area. And I'll tell you the opportunity that opened that up. In this area, I worked with 6 hospitals. I was behavioral health integration manager. While working with the hospitals, and they did not know this about me, but it was the best entrepreneur experience ever. They gave our team $7 million to invest. And my responsibility was to think about creative ways of how to develop programs to help hospitals save cost savings around patients that were difficult to treat or needed services in the community to not show up to the hospital, right? So readmission. And then I started learning the combination of things. One, because I had the background in entertainment and marketing and the background with social work and the background with always knowing that I had to initiate a process, they let me loose and I made the best of it. We did some capital projects. The largest project I did was $1 million project with an agency called Shepherd Pratt. The smallest project I did was an innovative project called Open Access. So now you have the convergence of this guy who understood the payer system, who understood how to market and knew what that was like to get up and talk to people and develop relationships through social work as a skill builder, and also understood the entertainment industry and knew the bottom line was about making money. And I know sometimes people shy away from that in my field. But the reason for why we don't shy away from it is because not just the bad guys get to have fun and making money, the good guys get to have some fun and making money too, because we're looking at how to sustain our models, right? How to make sure that we're impacting people and we're doing quality as well. And so the reason why I mentioned the smallest funded program that I developed is because it tells you it had the biggest impact and it cost us nothing. So I got with a psychiatrist. We had a homeless shelter and a pharmacy and a group of folks, a couple of folks from the county, Lasagna Kelly, who we talked about placing someone in a shelter to provide psychiatry services. That level of creativity exists, but who's going to do this for no money? The only way we could do it for no money is that we said, look, we're going to get you the relationship at this center where you can have an office space for free. So it's an extension of their business into this county. It's a county-based system in this greater area. And so we did that deal. We said, look, we're going to get a pharmacist who can deliver the medications that you prescribe because some of our patients are transient. And we said, look, we have no money to pay you upstart costs, but we're doing these in-kind things for you. We just want you to basically develop a proof of concept. That psychiatrist is still there to this day. That psychiatrist had provided services at a cost by just billing the insurance. And we knew that they were able to, we could develop a business case around that. If we gave you X amount of patients and you provide the service on site, you would be able to meet your bottom line. So understanding the dynamic of that, we also understood that working with that pharmacy would be beneficial. That program cost us nothing. The next one that I was really proud of with coming in this area, as they say, if you want to launch big ships, you have to go where the water is deep, right? We started thinking about some national providers around open access. The challenges that hospitals have is placing individuals with behavioral health or co-occurring conditions, meaning that they had a behavioral health condition and a physical health condition. And the behavioral health condition exacerbated the physical health, right? One example of that might be diabetes and someone who's experiencing depression. Because of what they're going through, they may not readily follow through with the recommendations because of the challenges that they're facing for management of diabetes. Well, there's a bunch of guys who developed a model and they were going to charge us about $25,000 per outpatient mental health clinic. There's about 6 of them launching big ships again. So we took these consultants, we were going to do our funding dollars and pay them $25,000. It took me 10 months to get that approved. So the free program was basically moving things through a process and getting it done. Getting 25 or a total of $50,000 when we had $7 million to spend, took 10 months to get approved. The juxtaposition was that the $1 million crisis house, which moved folks from the emergency department into the services they need for behavioral health, which is mental health and substance use disorders. That's what we mean by behavioral health. That program was approved within 2 or 3 weeks.
Wow, that's a really short period of time to like actually get everything up and running.
The magic in that taught me something very valuable. To Giovanni's question, when you're talking about paying attention to the dynamic of what you're interacting with. Pre-program, I was able to move it through because I understood the insurance world and how to get folks build a business case around reimbursement dollars. It made sense for that psychiatrist. Plus, I'm giving you a place you don't have to come up with capital funding for a new. So that works. The $50,000 didn't work because we're actually invested in a community external to the hospital, right? Those providers of services were external, but they were supposed to reduce. We wanted to give quick access for folks who needed those services. And because they would go to the ED, which is open 24/7, but they don't provide the services that they needed. So keep that in mind. The $1 million program was me recognizing that the language in the contract had changed for our funders to no longer have in perpetuity. So if we didn't spend dollars, we had to give it back. So paying attention
Wow.
to that legal language, which is why I got it through the door within a few weeks. And all it took, the 10 months for the $50,000 took so long because people really didn't understand what was happening, right? The reason why it took such a short period of time to invest is that we had the right partner with the right scope, with the right timing for when those dollars had to be spent. And I learned a valuable lesson about working with C-suite executives. And, there's no heart in it. Like I was bringing heart. I'm going, you got to do this program. It's going to give you a patient. And I eliminated the heart and go, do you want to do this? Make a proposal for me, knowing that my heart was still there, but I knew the dynamics of what I had to deal with. And we got that deal done and through. And they're now functioning in the county. But it taught me a very valuable lesson about launching big ships.
Yeah, and I love that quote, by the way. If you want to launch big ships, you have to go where the water is deep. To your point, I think like looking at your journey, you have schooled and skilled yourself, maybe kind of building up to this moment. You have these different skill sets, from the way that you've gone about your training. Some might say kind of non-traditionally, that you have an insurance background is hugely helpful as well, especially in the healthcare industry. Trying to understand the mechanics of that aspect. And I totally agree with you at this point in my journey that helping people and making money are not opposing agendas, because in order to help more people, you have to be financially viable. And I think that, those of us that have that sort of like bleeding heart to help people think that it must be evil to make money because we watch, people do it unethically, but it can definitely be done ethically so that you can scale. I want to touch on one more thing that you said. You've said a couple times, that there are certain qualities that are inherently Jamaican. And I find that so fascinating because they're qualities that I think, are like deep inside a person that are entrepreneurial and curious about the world. And I love that that is also part of the Jamaican culture. And I have not been to Jamaica, so you're just making me want to go there even more. That's really cool.
You should visit.
Yeah, yeah. No, I already wanted to more. Um, so when you're talking about, challenges for people with diabetes, you kind of brought me to something that I wanted to ask you about. So I'm a personal trainer and a motivation coach, and I call myself a behavior science nerd because I read everything about behavior science I can get my hands on. And I see mental, emotional, and physical wellness at this point as very closely linked. And it's been amazing to me that, through just some of my client appointments, analyzing their barriers to their physical health goals. And sometimes, like simply when we're exercising, has brought out, some very deep things, deep trauma to the surface. So I just wanted to ask you, have you seen a very strong link between our physical and mental, emotional well being? How has that shown up for, you from your standpoint?
The quick and easy answer is yes. The more detailed response to that is when I'm teaching students, I ask them, do you ever go to the doctor and leave your arms and legs at home? And they look at me like, what is this crazy guy asking? I said, do you ever take off your head and you leave that at home when you're going to check with the podiatrist just because you're going to see to make sure they look at your foot and check that stuff out? And they look at me with a bewildered look. And I say, well, why would we continue to treat people as if we're fragmented? The system that we have in place. So, uh, just to back up a bit, the basis of being a behavioral scientist and now layering on technology is that we think about people holistically. We know that sometimes we can compartmentalize, and that has its benefits. But the fact of the matter is that we're not showing up to a medical appointment with fragments of ourselves, but yet and still we treat people or we train people to respond to others' needs in a fragmented way. I think it's the piece that technology can help us to fix. The reason for that is that human beings can't help it. I mean, if we're overwhelmed, we have a lot of things going on. Sometimes we think fragmentedly. It's we have training or those type of things that we may have been a part of, but the piece that I find to be fascinating from the place where I sit as a behavioral scientist is I'm really interested in knowing from others with a certain level of expertise. There goes that generalist again. A little bit of what you have is going to help me problem solve something over here. And I had no clue of how to get that done. I talked about my team member Marco because Marco, his training is so vastly different than mine as a person who developed biomedical tools. But I think that that's where the sweet spot is. I think that you, as a person who's working with someone in terms of physical health, when folks are comfortable and they're having these conversations with you, I think the sweet spot is someone like me being able to help you navigate to what is beneficial and useful. If you think about an app like Calm or others, and I'll tell you all about a fascinating way a client of mine has used ChatGPT. But if you think about how an app like Calm works, it's wonderful for working professionals who might be approaching just sort of a challenge in their life, right? It's episodic, it's not chronic. And so you have an app that can be really useful with those sort of what we call mild experiences, right? It's not at the end of the spectrum where folks may be having chronic, severe mental health or substance use disorder problem. But the ability to help folks navigate that, I think that's what, when we talked about MIT boot camp, that's what they were able to do is pull folks together from a multidisciplinary practice perspective to help them to see where the magic of what they can do happen. And that's a beautiful thing to be able to do. The other piece that I was going to mention is that there's a huge science in this field. And when you are starting to integrate with the medical folks or your hardline medical folks, like a cardiology or a transplant, often folks have a hierarchy in how they facilitate things. The beauty of what we've trained is our science actually helps us to be able to fit in to that puzzle. You can have the hierarchy, but how we fit into that puzzle is what makes us dynamic, right? And then we can problem solve. And once I've problem solved something for you, because I'm able to take your knowledge and gel it together, and that's a skill in and of itself, and I've problem solved something for you, that helps to win over folks who may not normally think about sort of what behavioral scientists can do, or folks with social work backgrounds, whether or not it be technology or just the healthcare field in general.
Absolutely. And I think the combination of technology and the healthcare field is a field that that combination is going to be massively powerful across the next, long period. You did mention about a friend using ChatGPT, and I've seen on your link tree that you have some links about AI in the medical field. And obviously it's like a hot topic at the moment. Could I ask you what's your thoughts in regards to AI as it currently is and how it can sort of apply to understanding people better and helping people?
I love it. It's just like anything else. If you know how to prompt these types of large language models, it really can become a revolutionary process. What I was going to explain is I do have a client that utilized this, got out of the clinical role and became super curious about how it was being utilized. And I got to tell you, the way that it was used was to prompt specific things that might be swirling around this person's head. And by the way, I will say that they're a little bit more advanced than the average person in terms of their understanding and ability to create the prompts themselves. So that's really important. So that was good for me. But outside of the therapy room or the virtual therapy room, the use of it was I explored this particular emotion and I now need words or things to say that I might not readily remember in the therapy room, but I know the feeling of it, right? And so I create this prompt in ChatGPT about how do I respond to this specific situation. Give me expert prompts about what to do, like a tree, right? I need to have this conversation. What do I do in this situation that is mindful of my emotional tone, all the things that you can discuss in therapy? So that's one way that we use it. And I've been testing out the documentation, which I think is a low hanging fruit. I am not against it at all. And I know that there are a lot of people who are up in arms, but I think every generation have the thing that they are up in arms about. Here's how I use it. I use it to reduce burnout. So most of my sessions, back again to the business world, you want to make sure you have a business associate agreement here in the States with whichever AI company you're using. You want to make sure that your patients are signing a client's rights and know what it is that you use in your process. So those are just sort of the back end business stuff.
That's the insurance part of your brain.
That's correct. And then once you have those sessions that are recorded, the company that I used, and I wish I knew about them ahead of time or some advisory capacity because it would be fantastic. They have a portion of their tool that talks about the amount of time I'm talking versus the client. It also gives you the note based on standardized notes that you're supposed to do for insurance billing. And they now also have the treatment planning that's in place. We have not solved for this yet. The only thing I would rather have in place is that most of these use cases are actually embedded in the electronic health record. Like it shouldn't be the interoperability piece of it is still a problem to be solved, right? I know that there are folks who are using Fire and API integrations, but ideally, what it would look like is I start my session with my client. It pulls into the note and records it and type it, and it's doing that in the background. I'm focused on my client providing all the pieces that are important in terms of what the science says about how to engage folks in therapy. It does the documentation in the back end. And then here goes the kicker. It also makes suggestions about follow up, prompts the patients about how they can use some of these skills in real time on Tuesday because they don't meet with me until Thursday. Now you have a robust system, right? And so
I
that's
love
that's
that.
where the that's where the generalist comes in. Here goes the other side of it, and I built out my own. Peer measured is a tool that I'm building out. The other side of it is practitioners who are being trained to do this work, right? It does the screens for anxiety, depression, all of the things that we know folks could experience. Well, we use it a little bit different. That's the pivot that Halcyon made, right? We started becoming a training institution for emerging practitioners who are going to be doing this work. And then we layer on the technology. And it's, for me, it's not as I'm sort of tinkering on the line. I'm still learning some of the other stuff. I'm going through a course now. But often when I bridge the gap with folks who are technologists, it's really about advising them around how to bridge some of these pieces, right? The clinical work with the technology. And one of the ways we're doing it, and I don't see a lot of folks doing this now, is that there are a number of practitioners who need the training and need to understand how this is valuable to their work from a couple standpoints. One, from the bottom line, how do we make money and make sure that we're having the right billing codes go out and being able to do that through an AI interface embedded in the electronic health record. And I have some ideas about how folks can do it if somebody wants to do that. It's a huge market. I know it's tough to break in and disrupt. And then two, from the training standpoint, we are training every school in the United States have a requirement for an internship. And we don't train folks in how to use and layer in technology. So clinical language. So we have Care Measure that does all the screening and has decision logic in there. And we still are fine tuning. I'm actually talking to some folks that we met through MIT about layering this on, right? But the goal, my wish list would be that we have an electronic health record that was from the perspective of the practitioner. If you can do that, you will disrupt an entire industry. I'm talking about it's fit to purpose for folks who do therapy, fit to purpose for folks who do occupational therapy, a fit to purpose for the physician who needs to report out. AI can have the capability to do all of these things. I am going into a session after I leave with you all The reason why I'm not burnt out by it, and by the way, the reason why I can do half of this stuff is because I leverage technology, not because I'm superhuman, right? So the reason why I could do this is my session is recorded, my note is pulled from that, and I'm just focused on the client. That's it. Right? The documentation is done for me and it's pulled in the format that I need it. That's really, really important. And so the human element isn't lost and it becomes this layered on piece that just assists in the work that we do.
That's wonderful. And I really appreciate you where that technology is now, how you leverage it now, and then also talking about your wish list. You're getting my wheels turning about, who can I introduce you to who's also has an interest in that. Yeah, I really appreciate you sharing that. And I'll look forward to seeing that evolve. I can tell, we've got 4 minutes left. So we're definitely gonna have you back again at some point to talk, about the next developments in your journey. And if you start building out this tool or you inspire somebody else to, we'll be really excited about that. But I'd like to end with one final question that we like to ask at the end of the interview. What words of wisdom or piece of advice would you like to leave us and our community with today?
Uh, that is, that's a deeper question than you think, Nancy. You have to have a conversation with others who are from different disciplines. I have found that the reason why I can have this conversation with you today, and I hope that I've done a good job of curating a synopsis of my life, it's because the places, experiences, and people have enriched my journey. I cannot think about it as dynamic as I do without having had those different people and journey. I mean, if you look at St. Elizabeth, Jamaica, it is as rural as they come. And so I don't need a lot, right? I'm very, very easygoing because I came from a place that was easygoing. We know exactly what matters. And then you put me in a place of Hartford, Connecticut, a city, and I'm a rural boy, and you put me in a city and you go, make of this. And then I come to the nation's capital. Oh my goodness, what an experience. So, because I've interacted and engaged with different people, I've found that that's been the common denominator is be open to interact and engage with people who have different ideas than yours, because that's how I've learned the most. The folks who think like I do, I gotta tell you, they're boring. The people who are like edging up on like, I don't know if I like you that much. And you go, but tell me a little bit about how you think about this. And you go, man, that's some really interesting perspective. I have a young man who's 24 years old going off to the Air Force, and I'll leave you with this. He is clearly at a point where I think he's brilliant, right? And he said to me, how do you know that? And I go, dude, it is fantastic to have a conversation with. You think about things so different than I do, and you're open to the conversation. And I go, that's it. I think you got something here. And he's a handsome guy too. And he has a girlfriend and he's like really like way more grounded than he think he is. And he's kind of figuring it out. And I go, this is beautiful. And so I think that's his questions are just like really curious. And I think that that's captures it. Get curious about people, have conversations with people that you normally would not. Wonderful ideas come out of that.
Thank you very much. Now I know you have very limited time, and I really appreciate you coming here today and talking with us. It's been an absolute pleasure, and as Nancy said, we will absolutely have to have you back. I think there's no way we can miss out on hearing more of your journey.
Anytime.
Thank you, everyone else, for joining us. Nancy and I and the rest of the team behind Founders Voyage feel fortunate to be part of this community with all of you and for the opportunity to bring this cooperative learning experience to each week. Please join us next week at the same time for another inspiring conversation. And Dr. Wright, we would love to hear any nominations you have for future guests we should have on. We always like to bring in new people who give value and get value from the community. In the meantime, you can listen to our edited podcast under Founders Voyage on your favorite podcast platform or directly on our website, foundersvoyage.org, as well as we have a Patreon through which you can support us if you choose to.
Thank you so much. And I look forward to keeping in touch with you. Have a great rest of your Saturday.
Take care. Good to meet you all.
You've just finished another episode of Founders Voyage. the podcast for entrepreneurs by entrepreneurs. The team at Founders Voyage wants to thank you from the bottom of our hearts. We hope you enjoyed your time with us, and if so, please share this with someone else who might enjoy this podcast. You can also support us by leaving a review on Apple Podcasts and Spotify, and by donating to our Patreon. Outro music today is Something for Nothing by Reverend Peyton's Big Damn Band.